Hi there guys, welcome to the first in the series of Bulletproof Bodies Injury Prevention Program. We know here at Bulletproof Bodies that injury is the enemy and the only way you can overcome that is to bulletproof your body. Bulletproof Bodies presents the 10 most common injuries found in the extreme sporting arena, and of that probably the bulletproof shoulder is going to be the main one. This lecture wants to tell you a little bit about the anatomy and physiology of the shoulder, about how good posture will equal good movement, particularly when you're fatigued, what exercises put the shoulder at risk of injury, why the shoulder is at high risk of injury, a little screening test for the shoulder that you can do yourself, and how to use exercise to compensate for overtraining. So shoulder anatomy. I teach physiotherapy, that's what I do for a living, and the shoulder is not just one joint, but it's 4 joints. It's important that we recognise that. The main joint that we talk about is the ball and socket joint of the glenohumeral joint. So the long bone of the humerus, and then the socket, which is the glenoid. And that's basically a golf ball on a golf tee. This gives the shoulder a huge range of movement, so we can literally do anything with our shoulders, but it also means that it's unstable. Rotator cuff strength and stability seems to be one of the key things to keep the shoulder joint injury free. So let's talk about force couples. So when we're talking about force couple, muscles work in pairs. The pair that we're talking about, so proximal just means that it's closer to the midline. So we're talking about the big shoulder muscle, the deltoid. Deltoid's got 3 heads, okay, a posterior, an anterior, and a lateral head. And then we've got the muscles of the rotator cuff. On top you've got supraspinatus, below that infraspinatus, slightly down and to the right of that is teres minor, and on the back you've got subscapularis, and these guys work in conjunction with each other when we're doing anything heavy with regard to load. Now the distal force couple, that's a little bit different. So here we're talking about the upper trapezius, the lower trapezius, and the serratus anterior. So these 3 guys working together will get that upward rotation of the scapula, which is the shoulder blade. Now, particularly in CrossFit, where they do a lot of Olympic lifting, the upper trapezius gets really strong and dominant, and the lower trapezius and the serratus anterior are generally weaker and recessive. So that will give you some dysfunction if you're pulling too much from the top. You can see that those upper fibers of trapezius, if you don't train the lower fibers, then we've got a mismatch of force. So we've got to have a look, we've got to observe, and the first thing we're going to observe is posture. So looking at posture, particularly the CrossFit posture, a lot of the guys have got what we call a forward head posture. This is particularly relevant when you're doing squats or deadlifts. So the back has been rounded, the thoracic spine is slightly curved, we call that a kyphosis, and to compensate for this you lift the head up, which gives you this forward head posture. Combined with sitting for long periods of time, this will give you a tight thoracic spine and all that sort of stuff. If we look as well at this kind of bodybuilder posture, where we really concentrate on the muscles of the pecs and the lats, and those 2 muscles internally rotate the shank of the humerus, which means that we could be predisposed to impingement, and we'll come on to that in a minute. So if the shoulder blade is rolled forwards and it's higher, then it's not in an optimal position for movement. You might look good, but you won't move well. So when we're talking about posture, you can't fire a cannon from a canoe. What this means is that your postural muscles need to be stable before your prime movers can do, they're the ones that do all the business. So what happens, we get a lot of adaptive shortening and adaptive muscle patterning of these muscles. The pectoralis major and the lats get really, really tight from loads of press-ups and loads of pull-ups, and we're probably not doing enough heavy rowing to compensate for that. So what do we need? We need more body awareness and some dissociation skills. That's being able to move the shoulder blade into what we know will be the correct position, that of scapular setting. and with the CrossFit athletes I work with, we see a lot of dysfunction in the scapula and their shoulder blade. They can't get it in the right position. And sometimes some verbal, some visual cues can really help with that. So here's the self-test. We come on to this. And this is the CrossFit video that we've got here. Okay, and you can see that rolling of the shoulder. You're going to get shearing of the humeral head there, and that is not what we want. So pull-ups are probably the most dangerous thing in CrossFit. In particular, the kipping. It's normally the culture, particularly when you're fatigued or you're under load. You know, you're training with a heavy vest on, or you're doing a weighted kipping pull-up or something like that, and you get this uncontrolled movement where the humeral head begins to shear forwards and backwards. If you can't maintain a good shoulder position, simply if you're fatigued or you're pushing for reps, chasing the reps rather than working on form, that could lead to impingement. So there's a little self-test for impingement that we've got here, and that just all you do is place one hand on the opposing shoulder, grip hold of your shirt, lift up the elbow as high as you can. If you get any discomfort, then you're probably a bit tight. If it's painful, it could be the beginning of a little bit of impingement, and you might need to go and see a physiotherapist. Certainly you're going to need to stretch and mobilize and do what you need to do. So it's a lovely little test that you can do yourself. So what muscles do we need to stretch? We really need to stretch the pec major, and you can do that by keeping your one arm nice and straight. Okay, put it on a door frame and then just rotate your body away from that arm, feeling a stretch deep in the muscle there. You can do the same thing, bend your arm out at 90 degrees, hand nice and high, same door frame. This time the elbows at 90 degrees, and again you just turn out and away from it, feel that good stretch. And then lat dorsi stretch, really good one for this is using the band distraction. So just lean forwards with your arm above your head, and then just bring that arm across your midline till you feel a stretch down the sides, and that's what you want. Okay, what have you got to strengthen? You've got to strengthen your serratus anterior. Okay, you can do that by the press up plus, so holding a press up position, lock the elbows, and then just go backwards and forwards using the shoulder blades to do that movement. Lower fibers of trapezius, really good one there is getting on the rings, pushing down and externally rotating, just holding that position as well. Isometrically is probably the key for that. Rotated cuff strengthening, you can use a band for that. Again, isometrics work really well with both of these exercises, so you might want to get into that. If you're still having problems with your shoulder, we might need to look at the shoulder algorithm. So it might be tightness, it might be the capsule, it could be that the force couples aren't working correctly, so it could be a coordination issue, could just be a muscular balance issue. And here at Bulletproof, this is the scapular rehab algorithm that we use to get you sorted. So if that sounds like your sort of thing, what you need to do is come and check out our Bulletproof shoulder course coming to a CrossFit box near you. Just remember, guys, that injury is the enemy and you need to bulletproof your body. Come and check us out at bulletproofbodies.co.uk. This is Dale Walker and my partner Uzo Ekiog, and we look forward to seeing you soon. Cheers, guys. Bye.